My name is Taylor Parish, and I'm going to talk about cosmetic surgery risks. In the year of 2018, plastic surgery demographic trends show 227,000 cosmetic procedures have been performed on males and females between the ages of 13 and 19. This topic is relative to our society and generation because our generation is now engaging in cosmetic surgery at such a young age. Our generation is getting involved in surgery at a way younger age than any generation before, so it is very important this generation thoroughly understands the long-term risks of having all these procedures. As someone who has participated in having a cosmetic procedure at a young age, it is very important that one understands every risk these procedures really have on a person, especially one starting so young. I understand because of all the risks, some people have common questions and doubts about surgery for things that most of the time are not needed. Today I would like to inform my class of 3 serious risks to be aware of when thinking of having a cosmetic surgery done. There are many risks, but I will just be sharing 3, which are nerve damage, general appearance problems, and lastly, scarring. Cosmetic surgery can lead to have severe nerve damage. The Board of Plastic Surgeons states that the most nerve injuries are just temporary. Plastic surgeons are the ones who perform the procedures, although they have nurses all around their sides. The plastic surgeon closely watches over the patients, as nerve damage at all is never a good thing to hear when you're a surgeon. The surgeon's right-hand nurses and staff are all hands on deck as they watch over the patient and continuously run tests to try to get the feeling back in specific places of numbness. The patients are then given antibiotics the surgeon recommends and watch closely to ensure the best possible care and that they are there to catch any complication if one may happen. The surgeon, as much as they can, try to ensure that nerve damage does not take place in their patients. Most plastic surgeons have nurses along with the surgeon given many different jobs to make sure that they have a full team in the OR, or anything that could go wrong, they will have all hands on deck. The patients will be given their own hospital room, or in some cases get to go home as long as they have somebody to watch over them closely. Sometimes undergoing a surgery can result in having a general appearance complication. People sometimes do not understand that their bodies cannot get the outcome that they want and will even push their body to extreme just to try to achieve a look, and then it makes them look worse than ever before. And in return, it makes them regret their decision to even have the surgery in the first place. The more experienced someone is in getting plastic surgery, sometimes they take it to the most extreme. Forbes magazine has even said that many plastic surgeons fear patients do not fully grasp the gravity of potential risk factors having the same surgery multiple times. MedicalNewsToday.com stated many women who have self-esteem problems and feel as if their attractiveness level is low will undergo surgeries to change those factors about themselves. When considered, many plastic surgeons try to give their advice on how far a patient should push their bodies. The plastic surgeons are the expert here, so listen to their advice about how far to push your body. Listening to your surgeon could save a long recovery or even complications down the road. You can always come back later if you decide you want more of something or want to achieve a different look. It is very important to point out that the first procedure you may not see that much of a difference, but you can always go back for more. If you get too much at once, you may never be able to go back, causing complications in your body or a general appearance complication that makes you regret not listening to your surgeon in the first place. Undergoing plastic surgery can make patients experience severe scarring that never goes away and is very visible to the human eye. As ncbi.nlm.gov states, many patients complain that scars cause discomfort, tightness, or even pain. Although scarring is very common, very few people experience trouble with scarring to the point where it is unbearable. A detailed record in 2015, written by many authors, states that the skin scarring remains a difficult problem in medicine today and causes considerable morbidity. In conclusion, nerve damage, general appearance problems, and scarring are all potential risks for undergoing a cosmetic surgery procedure that patients should be aware of. As with any procedure, patients need to be aware of all the risk factors in surgery, even if it's just a minor procedure that you are undergoing. With all that being said, make sure to really consider all of the risks and weigh them out and make sure this procedure is worth those complications because it could happen to just anybody. In my introduction, I told the audience that many teens between the age of 13 and 19 were starting to undergo a cosmetic procedure. I hope the information I have provided you with will help you understand all the risks that can take place when having a simple surgery and when deciding if a cosmetic procedure is right for you. As Deborah Sullivan stated, cosmetic surgery is the cutting edge of commercial medicine in America, so it is very important that our generation, as young as we are, starting to undergo cosmetic procedures, really understand all the risk factors that play a role in this whole procedure process.